Bismillahirrahmanirrahim. Assalamu alaikum. This is Amanullah. You're watching my YouTube channel, Dr. Aman's video. We are going to discuss about the blood culture. So the question is, what do we mean by blood culture? Blood culture is a laboratory test in which we take blood from a patient and we inoculate that blood into the media present into the bottle in order to check the presence of any microorganism responsible for the microbial or infectious etiology of that blood infection. These microorganisms usually include bacteria, but sometimes fungus may cause infection into the blood, in which case it is called fungemia. There are some questions, common questions, which arise in the mind of a laboratory person about the blood culture. First, we will discuss those questions. Like, for example, what is the importance of blood culture? So, the first importance of blood culture is to rule out the infectious etiology of the illness, that this particular illness is due to any infectious agent, or is there any other cause of that illness. The second importance, that through blood culture we can isolate a particular pathogen and we can identify that pathogen. The third importance, that we can check that pathogen for antibiotic or antimicrobial resistance and sensitivity in order to optimize the antimicrobial therapy of that patient. The second common question arises about the blood culture is how much amount of blood is required to inoculate. So the answer is very simple. In case of adult, we need to take 10 ml of blood for one bottle of blood culture. Again, I repeat that we take 10 ml of blood in case of adult for one bottle of blood culture. In case of children less than 2 years, so we calculate amount of the volume of blood for the inoculation on the basis of the weight of the patient. So it ranges from minimum 2 ml to maximum 10 ml. So if you are interested to know more about the calculation on the basis of weight in case of children, so I will drop a chart in the description link. The third important question about the blood culture is how many blood culture set should be inoculated. So first of all, you should know that one blood culture set means that 2 bottles, 1 bottle for aerobic incubation in order to get growth of aerobic or facultative aerobic bacteria, and 1 bottle for anaerobic incubation in order to rule out the anaerobic bacteria if it is present in the blood. So one blood culture set is composed of 2 bottle of blood culture. So how many blood culture set we need to do? In case of adult, it is usually recommended that at least 2 blood culture set should be used for the detection of microbial etiology of the underlying illness. 2 blood culture set means that 4 bottle, 2 bottle in one set and 2 bottle in other sets. Some studies says that it is more preferable that 3 blood culture set, which means that 6 bottle should use for the detection of or the recovery of pathogen from blood if it is present. Studies, the available literature tells us that 1 blood culture sets recover 73% of the pathogen, 2 blood culture increase this recovery to 89%, and 3 blood culture set increase this to 98%. So therefore it is preferable to use 3 blood culture set for adult. In case of children, because the whole blood present in the body is very low, so the minimum requirement is 1 blood culture set, but it can be increased by keeping in mind the situation of the patient. So it can be increased from 1 blood culture set to 2 or 3. Now the other question is, which type of media should be used for the inoculation of blood? So the first and the important thing you must know that we always inoculate blood in liquid media, in broth inside the bottle. Why? Because in other cases, like in case of urine, pus and other specimens, we usually inoculate those specimens on agar, on the surface of the solid media. So why do we inoculate blood in liquid media or in broth? Yes, because in case of blood, we inoculate 10 ml of blood. We need to inoculate 10 ml of blood for the recovery of pathogen if it is present in the blood. So usually it is not possible to inoculate 10 ml of blood on the surface of the solid medium or agar. Therefore, it is recommended that blood should be inoculated into the liquid medium or the broth. Now, which type of medium is recommended? So you can use different media because different medias are available provided by different manufacturer, but the minimum requirement for the media used should be that it should contain the basic nutritional ingredient plus special growth factor. Why? Because it should be sensitive for the recovery of the growth of fastidious organisms which can cause bloodstream infection like Haemophilus influenza, species of Neisseria, species of pneumonia. So therefore it is recommended that blood should enough sensitive in order to recover or in order to provide a suitable environment for the growth of these fastidious bacteria. And the other aspect of that media should be that it should be versatile in nature, that it can be used for the other body fluid instead of blood. Like for example, it can be used for synovial fluid or CSF or any other fluid whenever, wherever it is required. The other common questions which can be used for which can be raised in the mind of a laboratorian is that what would be the timing of blood collection for different blood culture set? The answer is again very simple, that you can collect blood for different blood culture within 1 hour. The time interval between the collection of different blood sample is not significant. Therefore, you can collect blood for 3 blood culture set within 1 hour. But the recommendation is that you will have to collect that blood from different anatomical site. Now, other questions which can be raised, that how many days of incubations would be required for a blood culture? If you are using a continuous monitoring system or semi-automated bottle, then usually it is recommended that 5 days of incubation is okay. But some available literature say that 5 to 7 days are recommended, because in the first 3 days of incubation, almost 97% of the pathogens can be recovered. But it should be increased to 5 or 7 days for increasing the recovery of the fastidious organism if their quantity or if their number is very low into the blood. Therefore, we increase number of incubation to 5 or 7 days. If you get any growth in these days, then we need to process that growth for further identification and antibiotic susceptibility testing. If you did not get any growth in the 7 or 5 days, then you will have to declare that culture as negative. Other questions which can be used, that if we got any growth in blood culture, then it would be positive, true pathogen, or it could be pathogen. So therefore, the interpretation of blood culture is very important, because blood is sterile, but we can introduce contaminant during collection of blood. So therefore, whenever you got growth in case of blood culture, you need to carefully interpret that growth is a contaminant or a true pathogen. So commonly we use Bottle for blood culture. After inoculation, we incubate bottle into the continuous monitoring system. The continuous monitoring system actually monitor the bottle for the presence of any viable growth. If there is the sign of any viable growth, so the continuous monitoring system gives signal to us that in this bottle there are sign or there are indications of viable growth. Then we take out that bottle. First of all, we perform gram stain from that bottle. If gram stain is positive or negative, then we further subculture that sample on the surface of agar in order to get isolated and pure growth. So therefore, if the gram stain is positive or negative, then we use media according to the target organisms. Most commonly people use chocolate agar, blood agar and McConkey agar, but you can add other special media if required for the growth of special microorganisms like Campylobacter jejuni, if you are suspecting the growth of that. So it depends on the microscopy of the gram stain. After carefully examining the smear of the gram stains, we decide for the inoculations of media for subculture. After that, we keep those plate for incubation as we do routinely. After overnight incubation, we carefully examine the morphology of the colony and we perform different biochemical tests for the isolation and identification, and if it is pure growth and it is true pathogen, then we perform antibiotic susceptibility testing according to the clinical CLSI guideline as we have discussed in my previous lecture. Now little about the interpretation of the blood culture. If more than one bottle is positive in 2 or 3 blood culture set, and you perform subculture and gram staining, and you came to know that the organism is one and it is pure in nature, then we decide that it is bloodstream infection. Or if more than one bottle is positive, we subculture, we perform gram staining, we subculture, and we came to know that we have got growth of more than one bacteria or fungi. What we do, it is a polymicrobial growth. Then in that case, the recommendation is to repeat the blood specimen. But it is not always possible, particularly in resource limited setting. So in that case, we take decision or we do interpretation on the basis of clinical history, expert opinion and other factors. Though it is not recommended in any guideline, but in resource limited setting we have to interpret the available results. We are not able, we could not opt for the repetition of the blood culture. Same is the case if there is positive growth in only one bottle. So in that case, again the recommendation is to repeat, but as I told you, in resource limiting setting we are not able to repeat, then we have to interpret the available result. Now little about the most common contaminant. As I told you that contaminant come from the skin of the patient or from the hands of the person who are collecting the blood, or the instrument which we are using for the collection of the blood specimens for collection and inoculation both. So we can introduce contaminant in these events. So what are the most common contaminants? The most common contaminants are the coagulase negative staphylococci like Staphylococcus epidermidis and diphtheroids which are present on the skin, macrococcus, species of micrococcus, species of bacillus. So these are the common skin contaminants which can be found in the blood culture. So whenever you get growth of these common skin pathogen, common skin commensal, then in that case you will have to repeat the specimen, or you will have to discuss with the clinician and to consider the clinical history and other clinical setting in order to interpret the result, because there are some cases in which Staphylococcus epidermidis or coagulase negative staphylococci could be the true pathogen, like in case of the prosthetic associated endocarditis and many other, or catheter associated septicemia and many other cases. So therefore these are the common skin contaminant, but they can be pathogen, true pathogen, in very rare cases. So therefore different factors should be considered. So it was a short summary of blood culture. I hope you have enjoyed this lecture. If you have enjoyed this lecture, then I would request you for the subscription of my channel Dr. Aman's video, and always try to hit bell icon in order to get notification for my upcoming video. Thank you so much for watching my YouTube channel. Fi Amanillah.